Financial instability is undermining the health and well-being of Americans across this country. It is a root cause of many of the physical and mental issues people are facing today, and something can be done. In this video, I'll be making the case for why financial instability should be declared a public health emergency and why financial capability services like financial education, coaching, and career readiness can be at the cornerstone of addressing a long-term solution. In today's video, I'll start by making the case for why money and health are directly related. We'll be showing some evidence from federal government agencies that prove the case for us. We'll get into past precedents for declaring a public health emergency. I'll get into potential solutions, like I mentioned before, the financial capability services. In addition, how declaring a public health emergency can help to speed up the response of these services so we can help people now. Lastly, we'll wrap up by sharing what we're doing to advance this cause. But first, let's get into the case for money impacting people's health and well-being. Now, when we started this project about a year ago, there's a ton of research out there that show that there's a direct connection, but we came across something that was very easy for us to connect the dots with, which is two agencies under Health and Human Services, which is the CDC and Office of Disease Prevention and Health Promotion. Those are both agencies under the Health and Human Services Agency, which is responsible for declaring a public health emergency. And they have an initiative called the 2030 Healthy People Initiative. And in that initiative, the primary thing is the 5 social determinants of health. So there's 5 social determinants of health, or SDOHs. And in each of those 5 areas, money is either a significant or a dominating factor in that determinant of health. Let's go through those real quick, and I'm pulling directly from their website. So the first one is economic stability. I don't think I need to get into details there. Economic stability directly impacts people's health. They say people with steady employment are less likely to be in poverty and more likely to be healthy. They get into that a bit more there. Next one, education, access, and quality. Children from low-income families are less likely to graduate from high school or go to college. This means they're less likely to get safe, high-paying jobs and more likely to have health problems like heart disease, diabetes, and depression. Again, this is from government agencies right under Health and Human Services. Third one, healthcare access and quality. About 1 in 10 people, they say, in the US don't have health insurance. They may not be able to afford healthcare services and medication they need, things like preventative care and treatment for chronic disease. Again, they're making the case, and money is the primary factor here. The latest data I show, about 8.4% of people don't have health insurance. Fourth, neighborhoods and built environment. Many people in the U.S. live in neighborhoods with high rates of violence, unsafe air or water, and other safety and health risks. People with low incomes are more likely to live in places with these risks. They're more likely to be exposed to things at work that can harm them and their health. Again, all those 4, money was a dominant factor in those areas. And lastly, social and community context. They say many people face challenges and dangers they can't control. That statement there, I don't know what they meant by that. So that's why I say this one's a significant, where money's a significant factor and maybe not a dominant factor. But they also go on to say, like living in unsafe neighborhoods, discrimination, or trouble affording things they need. This can have negative impact on health and safety throughout their life. So the CDC and the ODPHP, both those agencies made the case for us. And there's also precedent for declaring a public health emergency. If we look at past public health emergencies, it can be made on a federal level, a state level, or a local level. So there's 3 levels of that. And again, on the federal level, you obviously remember COVID. That's probably the biggest worldwide, obviously. But there's other ones you may not be aware of, like the opioid crisis or the youth mental health epidemic, that were declared public health emergencies. From a state level, they have things like California declared vaping crisis a public health emergency. New York declared gun violence a public health emergency. On a local level, Chula Vista, California had issues with their trash, and so sanitation, public health emergency. And LA declared that a PHE for the homelessness crisis. So there is past precedent for declaring a public health emergency. And what again, the Health and Human Services states is it must meet certain conditions. And these conditions can be disease or disorder that presents a public health emergency or conditions that otherwise exist. And those examples I show you are conditions that otherwise exist. So there's a precedent there in declaring financial instability a public health emergency. In addition, a PHE can't be declared unless it's at a certain size or scale, right? It has to be large enough. It can't just be impacting 5 people down the street. It needs to be large in terms of size and scope and impact. And when we look at financial instability, if it was to be declared a public health emergency, it would be the second largest behind COVID in terms of dollar cost to taxpayers and the number of people impacted. The number of people impacted is about a third of the country. About 100 million people are being negatively impacted by their financial situation, and that's directly impacting their health and overall well-being. In terms of dollar amount, I see a lot of different numbers. We'll go with $1 trillion plus annually to be very, very conservative, factoring things like delaying healthcare getting worse and taxpayers take on that burden of a worse condition because there wasn't preventative care and things as one example there. So there's precedent. It meets the conditions that outlined by the HHS of conditions of otherwise exist. In addition, it is at the size and scope that requires immediate response to address and help our citizens avoid those issues that are directly impacting their health. Now, in terms of response, there's a lot of different ways to respond. Now, we've seen a precedent with COVID, how quickly they were able to respond to an issue. Now, I'm not saying they did everything right. There was a ton of mistakes there. But I think with this crisis, the financial instability crisis, we have the opportunity to mobilize people, get key stakeholders involved, and get the funding needed to deploy a workable solution that can have long-term benefits to the taxpayers. A cornerstone part of that solution should be implementing financial education at all levels, elementary, high school, and undergraduate college levels, as a proactive, preventative approach. We saw how quickly with COVID they shut down schools, they made people wear masks, they did other things. And I'm not saying, again, they made a lot of mistakes, but if we can learn from that and roll this out on a more structured basis where we're piloting different programs and initiatives as quickly as possible while being thoughtful in looking at the data and making data-driven decisions, we stand a good chance to help these youth graduate capable to make near-term financial decisions and avoid a lot of the challenges and problems people get into that lead them to financial instability. If we look at financial instability, typically we can trace it back to early financial decisions that got people behind and they just weren't able to catch up or dig themselves out of the hole. We can also institute quite rapidly other services that are helping people that are in those types of conditions through financial counselors, coaches, career readiness people, and again, financial education on a more reactive level. So supporting those people that are on public assistance and needing our help and support to help them wean them off of that need and help them gain the skill sets and increase their opportunities for increased job opportunities, better manage their money, and work toward more financially stable conditions. Again, we can do that on a very quick basis, as we saw with COVID. But I think, again, with financial instability, we can roll this out in a much more succinct fashion where we're looking at the data and making data-driven decisions to make improvements across a variety of pilot programs across this country. It's important to note as well, it does not need to be on a national level. Now, the Health and Human Service Department on the national level, they can declare a public health emergency that would impact everybody nationally. But it can also, as I showed before, it can be declared on a state and local level. What we're doing to advance this is attacking this on all three levels. We're doing a campaign which is promoting declaring financial instability a public health emergency at all three levels of that. So if we can find some local governments, some states, and hopefully work up to that national level, the case is there. I think we've made the case. It's impacting people's health in a very negative way. And there's proactive ways we can address this for long-term solutions and reactive ways that we can help people as well. Uh, these would have, even though there would be some type of investment required early on, long term, it could save the taxpayers a lot of money. Equally as important, it can help people achieve that stability in their life they need to be happy, healthy, productive members of society. Help them get the health care and services they need without delaying, medication, skipping medication, delaying health care, skipping preventative services, and make sure we're growing a healthy America. Uh, Please support us in this initiative. We have an advocacy committee that is focused on this. We're doing a timely campaign here at the start of September. It's what we call our United for Action Week. We'll have a major letter writing, major call campaign, in addition, press, media, and outreach to key stakeholders at the local, federal, and state level. Please join us. The link will be below. I appreciate your time, and let's work together to give this attention, this pressing matter that's impacting 100 million Americans, the attention it deserves. Let's empower people so they can achieve financial stability.